There are a lot of health myths out there, and some can actually be dangerous to your health. Here to dispel some health myths is Dr. Shad. Doctor, thank you so much for being with us.
My pleasure. Thank you.
First off, there are a lot of myths in general about vaccines. So talk to us about the COVID-19 vaccine and its safety.
It's absolutely safe. I've actually received my first dose of the Pfizer vaccine already myself, and have had very minimal to no side effects, a little bit of arm soreness. It's really unprecedented, particularly these two vaccines from Pfizer and Moderna. Both are a brand new technology, mRNA, where they don't have a lot of the allergens and capsules that come from eggs or maybe connected with peanut allergies. All those things are basically not there. It's a very clean vaccine, which doesn't even have live virus in it. The safety is definitely on par, if not better, than a lot of the long-standing vaccines that we've had so far based on what we've seen with the studies. And the efficacy, which shows basically how effective it is in reducing the severity of illness from a COVID-19 infection, is after the second dose is in above 95%, which as a point of comparison, the typical flu vaccine every year is anywhere between 50 to 60% in terms of efficacy. So this is a big jump forward in terms of how efficacious it is, and it's definitely something that the public can rely on as something both safe and effective.
Yeah, absolutely. That's great to know. So, Doctor, food is medicine. It's a popular buzz phrase that's been going around for a while. Is this true?
It is absolutely true. It's actually an ancient concept that Hippocrates is attributed to saying, "Let food be thy medicine and medicine be thy food." And many cultures have home remedies associated with food. And it's only now in science and medicine that we're starting to see with the new fields of epigenetics and nutrigenomics that food is actually medicine, even at the molecular level, where food actually is like a signal that basically turns certain genes on and other genes off. In the time that it takes for our taste buds to turn over, let's say, for example, you stop eating high salt or high sugar for about 3 weeks, you can actually turn on or off hundreds of genes by change in your diet. And those genes can either be good genes that help contribute to heart health, brain health, longevity, or they can be genes that actually promote heart disease or cancer or other diseases. And the standard American diet, which is mostly over 65% processed foods, or what I like to call frankenfoods, and food-like substances, have been associated with a lot of these diseases. And actually, things like excessive alcohol intake, excess sugar intake, all these things can actually contribute to our genes going in the wrong direction in terms of their expression for disease. And so food as medicine has also been studied with specific diets. Some of the best examples include the Mediterranean diet, which is actually shown to be better than even statin medications at preventing heart attacks and strokes from occurring. We also see it with the DASH diet. It's another example for lowering blood pressure. And of course, type 2 diabetes is directly linked to diet. And so you can use food as medicine to either avoid medications or wean off and reduce the number of medications you take for your chronic medical condition.
Now, Doctor, 10,000 steps. Is this the magic number per day that we want to achieve to maintain our health?
10,000 is definitely great, but it's not the magic number. You can actually get many health benefits from even less steps than that. 10,000 actually came from a Japanese company that started pedometers in 1965, and it wasn't really based on any scientific studies as a threshold for health. In fact, there's been many studies that have been done, one in particular with over 16,000 women aged 61 to 101, where they looked at their steps and they found that even with 4,400 steps, they had a 41% decrease in mortality. And if you increase that to 7,500 steps, that was a 65% decrease. And so the bottom line is just move. Even taking some steps as little as 4,000 steps a day can have a big impact on your health.
Doctor, thank you so much for your time. We appreciate you. If you'd like more information about Dr. Shad, head over to his website.